Hi, my name is Megan Schweier, and I'm here to talk to you today about multiple sclerosis. What is multiple sclerosis? MS is an unpredictable disease of the central nervous system that disrupts the flow of information within the brain and between the brain and the body. It is a chronic, inflammatory, demyelinating disease of the CNS. The cause of MS is unknown, however, there is something that triggers the immune system to attack the brain and spinal cord. The immune system attacks the body's myelin sheath, which is the covering around nerve fibers. The attacked myelin sheath results in scar tissue or sclerosis, which then interrupts nerve impulses traveling to and from the brain and spinal cord. T cells are passed from the bloodstream to the CNS to attack the myelin sheath. The severity of MS in individuals varies from person to person. What causes MS? Although the cause is unknown, research done shows that the disease is caused by an interaction of many different factors. Recently, researchers have been able to figure out which immune cells are the attackers, factors that cause them to attack, and some of the sites on the attacking cells that are attracted to myelin sheath. Facts about MS. More than 2.3 million are affected by MS in the world. Even though anyone can develop MS, women are 2 to 3 times more likely than men, and this gender difference continues to increase. MS is most common in Caucasians of Northern European ancestry, and those that are diagnosed usually range between the ages of 20 and 50. However, some cases have been diagnosed in someone as young as 2 and as old as 75. MS is not contagious or directly inherited. Certain genetic factors and environmental factors may make someone more susceptible to developing the disease. And there also is no single test to prove or rule out MS, and symptoms vary and may be nonspecific. There are 4 different types of multiple sclerosis: clinical isolated syndrome, or CIS, relapsing remitting MS, or RRMS, primary progressive MS, or PPMS, and secondary progressive MS, or SPMS. So CIS is the first episode of MS. It's characteristic of MS, but does not meet the criteria for a diagnosis of MS, since some people who experience clinically isolated syndrome may or may not develop MS fully. The episode must last at least for 24 hours, and if CIS is accompanied by brain lesions that are similar to those seen in MS, the person has a higher chance of a second episode of neurological symptoms and a diagnosing of relapsing remitting MS. If CIS is not accompanied by brain lesions that are similar to those seen in MS, the person has a much lower likelihood of developing MS. Relapsing remitting MS is characterized by clearly defined attacks of new or increasing neurological symptoms followed by periods of remission. During remission, all symptoms may either disappear or continue and become more permanent. There are not signs of progression of the disease during periods of remission. RMMS can be characterized into 4 categories: active, with relapses and evidence of new MRI activity; not active, with no relapses and evidence of new MRI activity; worsening, with a confirmed increase in disability over specific periods of time post-relapse; or not worsening, no increase in disability over specific period of time post-relapse. Primary progressive MS is characterized by worsening neurological function from the onset of symptoms without periods of remission. PPMS can be further characterized at different points in time as active, with occasional relapse and evidence of new MRI activity; not active, with no occasional relapse and or evidence of new MRI activity; with progression, with evidence of disease worsening on an objective measure of change over time, with or without relapse of new MRI activity; or without progression, with no evidence of disease worsening on an objective measure of change over time. Secondary progressive MS follows the initial relapsing remission course, eventually transitions to a secondary progressive course with progressive worsening neurological function. SPMS can be further characterized at different points in time as active, with relapses and or evidence of new MRI activity; not active, without relapses and or evidence of new MRI activity; with progression, evidence or disease worsening on an objective measure of change over time, with or without relapses; and without progression, no evidence or disease worsening on an objective measure of change over time, with or without relapses. Signs and symptoms of MS. There are many signs and symptoms. No 2 people can have the same ones, and here are some more common ones. Fatigue occurs in about 80% of people and can significantly interfere with everyday life. walking difficulties, which is related to weakness, spasticity, loss of balance, sensory deficit, and fatigue, and can be treated with PT. Numbness or tingling occurs in face, body, or extremities, and often the first symptom experienced in those diagnosed with MS. Spasticity are feelings of stiffness and a wide range of involuntary muscle spasms, and they occur in the legs. Weakness results from deconditioning of unused muscles or damage to nerves that stimulate muscles. Vision problems, blurred vision, poor contrast of colored vision, pain during eye movement, and this is also often the first symptom experienced in those diagnosed with MS. Dizziness or vertigo, someone with MS may feel off-balanced or lightheaded, or they also could have the sensation that the room is spinning. Those with MS could have bladder problems. The bladder dysfunctions occur in about 80% of people with MS. Sexual problems. Sexual responses can be affected from damage to the CNS. Bowel problems. A person with MS can have either constipation or loss of control of bowels. Or pain syndromes. In one study, 55% of people with MS had clinically significant pain at some time, and almost half had chronic pain. Cognitive changes. High-level brain functioning is affected in more than 50% of people with MS. Emotional changes results from the stresses of living with MS, as well as the result of neurological and immune changes, and also depression. Studies show that clinical depression is the most common symptom in those with MS. So some less common symptoms. Speech problems, slurring, and loss of volume occurs in approximately 25 to 40% of people with MS. Swallowing problems results from damage to the nerves controlling the many small muscles in the mouth and throat. Tremors, uncontrollable shaking can occur in various parts of the body due to damaged areas along the complex nerve pathways. Seizures, the result of abnormal electrical discharges in an injured or scarred area of the brain, and this occurs in about 2 to 5% of people with MS. Breathing problems occurs in people with weakened chest muscles due to damaged nerves that control those muscles. Itching, abnormal sensations such as pins and needles. Headache, people with MS have an increased incidence of certain types of headaches such as migraines. And hearing loss, approximately 6% of people with MS report hearing impairment. So to diagnose MS, there is no single test, specific set of symptoms, or physical findings that determine if a person has MS. There is criteria for a diagnosis of MS, and in order to be diagnosed with MS, you have to meet all 3 of these criteria. So you must find damage in 2 or more separate areas of the CNS, which includes the brain, spinal cord, and optic nerve, and you must find the damage occurred in at least 1 month apart, and you also must be able to rule out all possible other diagnoses. So ways to make diagnosis include magnetic resonance imaging, or MRI, which is a diagnostic tool that currently offers the most sensitive, non-invasive way of imaging the brain, spinal cord, and other areas of the body. Cerebral spinal fluid, certain changes in the clear liquid that surrounds the brain and spinal cord indicate an abnormal immune response within the CNS, and evoked potentials allow the ability to detect the slowing of electrical conduction due to demyelination by testing the measure of the electrical activity in the brain in response to stimulation of specific sensory nerve pathways. The life expectancy of those with MS continues to increase over time. This most likely is due to breakthroughs in treatment, improved healthcare, and better lifestyle changes. Research does show that those with MS live an average of 7 years less than those without MS. However, this is due to disease complications or other medical conditions, and many of these complications are preventable or manageable. So treatments and therapies. Medication is used to modify disease course, treat relapses, and manage symptoms. Along with other therapies and treatments, comfort and quality of life can be increased. Clinical trials have showed that medications can reduce the number of relapses, delay progression of the disease, and limit new disease activities. Rehabilitation. So the goal of rehab is to improve and maintain function, and it can address problems with everyday activities. Physical therapists are used to evaluate and address the body's ability to move and function. Physical therapy emphasizes walking, mobility, strength, balance, posture, fatigue, and pain. And the goal is to promote safety, achieve and maintain optimal functioning, prevent unnecessary complications like deconditioning, muscle weakness, and muscle contractures. Occupational therapists are there to provide training in energy conservation techniques and the use of adaptive tools and devices to simplify tasks at home and in the office. The goal of occupational therapy is to enhance independence, productivity, and safety in all activities related to personal care, leisure activities, and employment. Lastly, we have complementary and alternative medicines, other known as CAM, variety of interventions ranging from diets and supplements to meditation and Tai Chi. Things such as vitamin D, exercise, acupuncture, cooling strategies are all establishing a role in comprehensive care through scientific study and clinical trials. When these things are used in part with conventional medicine, they are defined as complementary, and when these things are used instead of conventional medicine, they are defined as alternative. The American Academy of Neurology released a guideline on the use of CAM to address the following questions. Do CAM therapies reduce specific symptoms and prevent relapses and disability? Can CAM use worsen MS or cause serious adverse effects? And can CAM use interfere with MS disease-modifying therapies? Here are some of the benefits of exercise in those with MS. People with MS who participate in aerobic exercise benefit from cardiovascular fitness, improved strength, better bladder and bowel function, less fatigue and depression, a more positive attitude, and increased participation in social activities. Inactive people with MS have weaker muscles, decreased bone density, increased risk of fracture, and shallow, insufficient breathing. An exercise program for someone with MS should fit their capabilities and limitations of the individual. Exercise does not have to be a cardiovascular workout. It can be things like gardening, household chores, and cooking. Aquatic exercises have proved to benefit people with MS, which is why water is an awesome exercise tool. Buoyancy provides support for weak limbs, greater range of motion can be achieved, and relaxation is promoted. Viscosity, resistance of water, can be used to improve muscle strength as well as balance and coordination. Hydrostatic pressure provides support during movement. And temperature control. Cooler water maintains lower core temperature, which is helpful for people that have heat sensitivity problems. Aquatic exercises improve overall physical function, including walking, mobility, flexibility, balance, and endurance. So, case study. Patient was diagnosed with MS at the age of 20. She is a female and 67 years old. Her BMI is 28. She's a non-smoker. Her blood pressure is 122/82. Her mother had a heart attack at the age of 50, but she has no family history of MS. Her fasting blood glucose is 90. Her total cholesterol is 180. Her HDL is 35, and her LDL is 100. Her triglycerides are 65, and the medications or treatments that she undergoes is a Glotopia injection, 20 milligrams 4 times a week, and she does at-home exercises 2 times a week. For her risk stratification, she has 2 positive risk factors, her age and her family medical history, so her risk level is moderate. Her goals are to maintain the ability to do everyday tasks of daily living, to participate in recreational activities without the risk of falling, and to improve her mental outlook and positivity. Her exercise prescription. For aerobic exercise, I have her doing 3 to 4 days a week with a moderate intensity, so this is going to be 50 to 70% of her max heart rate, which is 153 beats per minute. Her time is going to be about 30 to 45 minutes, and type is going to be water aerobics or cardio in the pool. So this could be marching, jogging, jumping jacks. For resistance training, I'm going to have her do this 2 to 3 days a week with a low to moderate intensity, so low weight, high reps. I want her to do 2 to 3 sets with 12 to 20 reps, hitting 6 to 8 major muscle groups. So this is going to be benefiting for muscle endurance. And the type of resistance training, I want her to use seated machines so that she doesn't have to worry about balancing or falling. And then I also told her to look into resistance training in the pool using water dumbbells, which also reduces the risk of falling, and then the resistance only is the water that you're pushing against. So in conclusion, multiple sclerosis is an inflammatory disorder of the brain and spinal cord. T cells attack the myelin sheath on nerve fibers, which causes a disrupt in information between the brain and spinal cord. The damage to the myelin sheath forms scar tissue that interrupts messages and impulses being sent to the body. There is no cure to MS, however, studies show that exercise can significantly help improve many of the symptoms that go hand in hand with having MS. And exercise can improve someone's quality of life and comfort if they are diagnosed with MS. And here are my references.